Hi, my name is Dr. Coulter, and I'll now be talking about septoplasty and turbinate reduction surgery. This is most commonly done to help with nasal congestion or difficulty breathing through the nose, but can also be done to help with sinus drainage, nosebleeds, and poor sleep. In a perfect nose, the left and right nasal airways are equal in size. The nasal septum divides the two sides. Some people are born with a crooked or deviated septum. More commonly, trauma to the nose can cause it to shift. The nasal septum is made of bone and cartilage, covered by special skin called a mucous membrane that has many blood vessels in it. There are also turbinates on each side wall of the nose. These can be large for a variety of reasons, causing blockage. If a patient has bothersome symptoms due to their deviated nasal septum or large turbinates, and medications are not helping sufficiently, surgery is an option to make the nasal airways more open. Septoplasty and turbinate reduction is a surgery that's performed through the nostrils, so there's no outside scar or bruising. These two procedures are usually performed together, although turbinate reduction alone may be best for some patients, in which case it may be done in the clinic while awake, and recovery is more minimal. Otherwise, this is typically done under general anesthesia while asleep. Crooked parts of cartilage and bone are removed, and the septum is reconstructed to be straight. For turbinate reduction, excess tissue is removed and pushed to the side. The time required for these surgeries is about 1 hour. Patients typically go home on the same day of surgery. To help with healing, large nasal stents are placed inside the nostrils until they are removed at the post-operative office visit about 1 week after surgery. It is crucial that the patient keep the nose very moist during recovery. Every 2 to 3 hours, apply gentle saline rinses and ointment inside the nostrils. The more frequent moisturization, the better and quicker the healing. This is one of the most common ENT surgeries, and patients typically do very well. However, the nose is very sensitive, and pain is usually moderate to severe for a few days afterwards. There are risks as well, including severe bleeding from the nose. Minor bleeding almost always occurs for the first couple days. There's a small risk of infection in the nose. If the skin flaps of the nose are not put back together just right, a hole can develop in the septum, connecting the left and right sides of the nose, called a septal perforation. This is rare, but can cause annoying crusting, whistling of the nose, and bleeding. It can be repaired with another surgery if needed. The upper teeth can be numb after surgery, as the nerve that goes to them travels in the bottom of the nose. This feeling usually comes back, but can take months sometimes. Very rare risks are damage to the skull base, causing brain fluid leak, or change to the external shape of the nose. There are general risks with anesthesia as well. I hope to discuss further details with you soon.